So here we're going to be talking about PRP. Do you guys know about PRP at all? A bit? Okay. We'll start right at the beginning, and we have Dr. Sandrine Grept-Locher, who is an absolute expert in this area. We have Sherina, who needs no introduction. And PRP, it's a regenerative therapy. It's using our own blood to produce a plasma full of regenerating molecules that can really help recondition our skin. So where should we start with explaining how PRP has come about as a regenerative technology and why it's so good? Sandrine, could I ask you?
So I think it's a long story. Yes, so I think, maybe I'm wrong, but I know that PRP first was used for horses.
Okay.
Veterinary indication, especially for very expensive horses who just...
So they're joints and things?
Absolutely.
Okay.
Yes. And after, the idea was to use the PRP with its
regenerative, sorry.
Thank you. Capacity. Use it for human, of course, joints, and also urology, gynecology, ophthalmology, and at the end, aesthetic.
Okay, so the aesthetic development of it is something quite new. So
Absolutely.
it's well known as a regenerative therapy before it came to the face.
Absolutely.
Which I think is interesting because there are a lot of facial therapies that are used when we feel that they've come out of nowhere and we don't know so much about it. Now, Cheryl, you're going to be actually doing a treatment. How are we going to incorporate you in this? Do we need to ask you?
Just before I'm going to start, so I'm going to just show everybody that we've already spun the blood, and here is the plasma. So you can see that the plasma is on the top and that's mixed. This is a cellular matrix, it's mixed with the hyaluronic acid, and then you can see the red cells at the bottom and it's separated. So it's
And this cellular matrix, can we explain that a bit? Because that's the technology that you are using, that Sherina's got here, the Regen Labs technology. It's not just any old centrifuge device, is it? Could you say why it's so specialised?
Yes, this is the devices that we use to get matrix, cellular matrix. So it means, and it's new and it's unique. So this technology is the only one in the world. So we collect the blood here. We have this separated gel here, the white thing, and at the bottom of the tube we have the hyaluronic acid, pure one, non-reticulate. The idea at the end of the centrifugation, spinning the tube, we get PRP and HA, and that's the new technology, that's the new thing, that's the new glow for the face.
Okay, thank you.
Yes, that's.
And Sherina, why do we want to add hyaluronic acid into the PRP in this way, and what's the benefit of that?
It's evolution, really, Alice. It's a great question. Why not? And then what? We saw some great results in orthopedic surgery. But Mark explained, and Dr. Sandrine. Orthopedic surgeons have been using PRP to regenerate wounds after surgery, for knee replacements, things like that. We had a brilliant lecture from a cardiothoracic surgeon in Paris last week, and it was wonderful. And he was using a different version of PRP, where it almost semi-solidified a little bit. And in his open heart surgery wounds, he would leave that plug. Yeah. He closed his wounds because these sternal wounds have a high risk or higher risk of not healing very well sometimes because your patient was older. So the highly regenerative capacity of this sort of materials within the wound helped it heal faster, more effectively, and with a lower reduced incidence of wound infection by up to 7%. So for him, as a reconstructive plastic surgeon, that's formidable. Wow. Where you now see the advancements of those sort of regenerative therapies come into the aesthetic arena is, why not? Why can't we take those things and use the same concept to revitalize our skin using our own autologous blood? And then obviously we start thinking about our own skin layers, our collagen, our elastin, our hyaluronic acid. I think everyone here is very well versed on what a hyaluronic acid is. It's a sugar in the skin. And similar to the proteins, we start losing them 1% every year from the age of about 25 to 35. So why not replace them? Why not embed it in your own autologous blood? Why not re-inject it into the skin very delicately? And you can see where Cheryl's injecting, it literally is on the surface.
So what Cheryl's got in that syringe is the final mixture of the PRP and the cell matrix. And the injection technique, now this looks really interesting because is this very superficial into the skin? Yes. So it's not like a deep burrowing kind of injection that a lot of us will know for fillers or anything. And you're just doing these tiny pinprick blebs of the product. Yes. So will that then find its way around
into
under
the
skin?
channels?
Okay. Okay.
So she's creating, small channels, and the drop will go inside and
Okay.
feed the skin.
Yeah.
And it's not necessary to go too deep because your goal is collagen stimulation, production of hyaluronic acid, elastin, new keratinocyte, improve also the vascularization to get more oxygen to the skin. And so the goal is the dermis, and the dermis is 1-2 millimeter deep.
Yes.
So you want to keep it right in that top bit, which is where it's going to work.
Yes.
So which is why, as Dr. Sandrine was saying, in order to get it to that layer, you have to be very, very precise in what you use. Come in, everyone. You have to be very precise because you have the knowledge of the layers of the skin.
Yeah.
So we say, okay, if we need to get it there, then we need to invest in different types of needle manufacturing. So we go back to our suppliers and we look for the best needle quality. We don't just take what's in the pack.
Okay.
You know, we're never satisfied. We want the best.
That's nice of you. And is it a really fine needle so it doesn't hardly hurt at all?
Gosh, I can barely see it.
Yeah.
You know, you don't have my glasses on. So, you know, needle manufacturing, this is what, 33 gauge?
Yes.
Yeah, barely see that. So,
Yeah,
you know, normal
tiny.
needles are about 30 gauge, and even those 3 gauges make a significant impact to the patient. So we've seen advancements in needle technology, and then finally technique as well. Technique is really skilled, and Cheryl has been, gosh, how long have you done nappage for, Cheryl? Exactly.
Okay.
Okay. So, you know,
10 years.
we're talking of, you know, a decade of experience
Yeah.
in a very, very refined French technique of nappage, as you can see. And us injectors sometimes find that very difficult to do. I don't know if you find that, Tash. You know, we are slightly heavier handed in a delicate way, but we don't do it
Well,
quite
you're
as
doing a
well.
very different thing when you're injecting filler for volume or structure, aren't you? I mean, this is quite
Refinement.
difficult, different. But Donna, it looks quite comfortable. Is that okay?
Very comfortable.
Yeah, you look really pretty relaxed.
Yeah.
Which is
Taking
good.
myself up to a very nice place.
But is this the kind of product that you could use with a cannula, fanning it around the face more deeply? Does it just depend on what the patient needs?
Absolutely, it's a good question. Yes, you can use cellular matrix with different kind of techniques. So in my practice, I do the lavage technique, of course, but also sometimes I go deeper in the deep dermis with a cannula to spread all the product deep. And just one thing, just be careful because it contains hyaluronic acid, and hyaluronic acid brings a lot of water, attracts a lot of water. So you have to avoid this area when you go deep with the cannula. That's the only thing. But you can use it also, and I do it in my practice. You can use matrix also for the lips. If you want to improve the dryness, if you want to improve the coloration, the vascularization, if you want to make them look younger, if you want.
Yeah, sure.
So I use a cannula and I go in the red part of the lips just to rejuvenate, to stimulate the lips, to make them look younger.
Okay.
It's really interesting. Yes, you can feel free because PRP is not dangerous because it's autologous, your own cells, and so you can be creative. You can imagine a lot of things.
Okay.
Yes.
And can you take this nappage right up under the eyes?
Absolutely. The nappage
Is that
technique
good
is
for dark
okay.
circles?
Yes, it is for dark circles. The coloration also.
Okay.
Yes.
I do under the eyes, but I do glasses. Yeah, new needle.
And because a new needle is always sharper, so it's more comfortable, which is another kindness to the patient that thoughtful practitioners will do. And with a treatment like this, is it a one-off? Should you do a course of them? How close together should they be if you do a course?
We generally say that even just with one session, you will see and feel the difference. I've only had just the one session, and that was when Mark and the team came and dropped the device in the clinic, and we had our training, etc. And I've been looking forward to having an autologous treatment, which is a self-made, homemade by myself. Within my skin, I haven't had a deep filler treatment as yet in my life. Will I? Absolutely. However, I felt very comfortable with the fact of having something revitalizing like this, and which helped.
Yes.
So when we brought the device in, I had worked with other autologous devices in the past, probably in 2010 and 12, and the centrifuges were different. They were probably about 3 times the size, and they were harder to put together, etc. And you had to blend lots of things, and it was probably a little bit more uncomfortable back then as well. So the refinement of everything from the technique and the needle tip, etc., it was very, very a different experience as a whole. So when Cheryl treated me, it was very interesting because I thought I might need numbing cream and topical anesthesia and all those things. But it was a mega comfortable experience just because it's all been put together so beautifully. And as Cheryl was saying, the last thing she would inject is around my eyes.
Okay.
And I think for days or weeks after that, I was getting a lot of comments about my skin.
Yeah.
Just that inner glow, that natural glow. So when adding to Dr. Sandrine's mention of the word revitalization, rejuvenation, what does that really mean? Does it mean, we want to say it's like bringing back to life, bringing back what we've actually lost for a period of time, just because we're not sleeping well and we're just going through life and we've got kids, whatever it is. And if you think of those end skin goals, from the heart to the tips of your skin, it's a long way. It's a huge journey. And those end arteries and those little capillaries, they're just kind of shrinking away from the top. So if we can find a way to get more tissue oxygenation and more tissue vascularization with treatments like this, treatments like the Saluma, treatments like lymphatic drainage that we get from the hydrofacial, and complement them all together, the tissue revitalization is there.
Yeah. Now, how does a product like this compare to something like Profilo or those other hyaluronic acid based skin revitalizing things? Have you guys heard about Profilo? It's
I love it.
a very fluid form of hyaluronic acid,
One of my favourites.
which is it's injected to sort of diffuse all over the face. It's like having a moisturizing serum on the inside of your skin. It's not like a filler because it doesn't have volume, but it just gives your skin that super hydration. But this is a bit more sort of specialized than that, isn't it? But how does it compare technically?
Okay, so Profilo and other fillers usually contain only hyaluronic acid,
Yes.
nothing else. And here with cellular matrix, you have hyaluronic acid for this plump and hydration of the skin, but you also have platelets and plasma. Platelets for their absolutely amazing rejuvenating power to stimulate the skin, to slow down the aging process, but also plasma. Plasma is really interesting because in plasma you find minerals, you find vitamins, you find amino acids, you find growth factor, also hormones. So it means that it's more complete than other products.
Yeah.
Yes, and so that's why it's interesting. It combines hyaluronic acid that you can find in other products, but there is also PRP
Okay.
to have this power
That's a good word.
to rejuvenate the skin. Yes.
Now, when we talk about PRP, usually the name Kim Kardashian comes up pretty quickly because she made it very famous as an idea by putting out that picture of her face with a vampire facial. But her face was covered in blood. As we can see now, the PRP part is the bit without the red blood cells. So how is what she was doing called a PRP, vampire facial, which is what people understand by it, and because it seems to be quite different to the kind of PRP you're using here.
Okay, so I think it's not different. I think the technique is different.
Okay.
Yes. So I think, tell me if I'm wrong, but I think they use PRP, platelets and plasma without red blood cells. But the technique is different. I think they go deep.
And had she been microneedled quite savagely before? Okay, so that's why her face appeared red. Because the trouble is, when you show someone a red face and talk about something that's been taken from their blood, you presume it's the blood that's on the face. But in fact, it was from the needling.
Of the technique and the needling.
So
that's it.
With that, would they needle and then apply the clear PRP serum on top? Okay.
Yes.
Just a
you can of course do this technique if you want.
Yeah.
You can use the microneedling, go deep, creating small channels like Cheryl do. You can use a machine, but of course it's much delicate. It's much more comfortable when you have a nurse or a doctor doing the treatment like this. Yes.
No, it's obviously a great technique for the décolletage, the chest bit that Donna's having done right now, because that's an area that rather suffers on all of us, isn't it? 'Cause it's like our own little solar panel, just kind of tilted up towards the sun, so it catches the sun even more than our face does, I often think.
I'm going to remember that word, Ellen.
And hands also.
And hands, okay, yeah. No, it's great, and your skin is absolutely amazing. Did you do this a lot? Your skin is incredible.
Thank you.
I mean, it was looking good enough yesterday downstairs in the world, but seeing it in this light, it's coming in. Have you guys seen Dr. Sandrine's skin close up? It is just. It's got this glow and translucence. So I don't want to embarrass you, but it is really amazing. Do you do a lot of
myself? Yes, I do. Yes.
Do you do it to yourself?
Yes, I do it to myself, for myself.
With this technique?
Yes, I use this technique sometimes, but it's not so easy when you do it for yourself because your brain,
the same angle,
your brain says, "Oh my God, it's gonna hurt," and your hands say, "Okay, I have to do that." So, so sometimes it's not so easy. So sometimes I use another technique. I go deeper because it's easier for me to do it like this.
I think your bathroom shelfie is going to look a little different to mine.
It's like sort of the ultimate mirror ritual, there you are actually with needles, but with a calm, lovely sort of different kind of Sunday night facial, really, wouldn't it be?
Give me 6 months.
But injecting yourself, I know a lot of practitioners who will do their own toxin, but they say filler is so difficult because obviously you're dealing with the sort of 3D convexities of the face, so you can't see that on yourself very easily. But no, not really one to try at home unless you're a medical expert.
No, I only do PRP for myself because I believe in the technique, in the treatment, in the device also. It's so important to have the right device because it's important because it's a question of the quality of the platelets inside. After centrifugation.
So the wrong kind of centrifuge can upset your platelets.
You're right.
Yes.
The wrong tube.
Everything. It's all.
Cheryl, are you going in around the eyes? Sorry to interrupt.
Do you want to come and have a look closer?
Does she mind? No, she doesn't take that.
Come and have a closer look if you want.
Do.
Should we be looking after ourselves a bit better in the days before having a treatment? Because I've heard of practitioners who will turn you away for PRP if you have been out having a drink the night before or indulging in any other not very good lifestyle behaviours. You need to have a few early nights. What's the ideal way to look after yourself before having a treatment like this?
Okay, so I think in Switzerland, if I ask my patient not to drink, not to have a glass of wine before, I will have nobody. No patient. No. So of course, it's really important to have a good lifestyle, to take care, to eat well, to drink a lot of water before the treatment, just for the quality of the blood and the quantity of plasma and platelets that you will collect. Yes, but no, of course, the result will be much better if you do exercise, if you eat well, if you, yes, of course.
So then you've got better quality better quality blood plasma, and that will
Yes.
knock on into a better quality result in the.
Absolutely. And
Wow.
be careful with the
Sunshine.
sun
Of course.
exposure.
Of
Of course.
Yeah.
Yes.
And I agree with Dr. Sandrine. I give it the advice to patients, look after yourself as best as you can in the run up to it. And I do get everyone in to actually have a hydrofacial before I treat them.
Right.
Because they're having then a lymphatic drainage right from the top layers of their skin flushing back into the soul. Okay? So they're literally being squeezed out, and then you're getting fresh new circulation coming back already in preparation for this. So even if they're just having one hydrofacial mixed together with some great topical skincare, a great cleanser, a great vitamin C antioxidant, and SPF, and ideally hyaluronic acid, and then we even just sprinkle one session of this. This is very fantastic protocol. And you asked earlier, Alice, how many series a patient could have with this, and we recommend a series of 3.
Sure.
One treatment once a month, 3 months. Let the skin alone. You can continue your hydrofacials every month because a lot of our patients are on strategic protocols. We can keep escalating their skincare. And every 90 days we bring them back. We have a series of images checked, like Nick Sinclair downstairs. We also have a 360 imaging device called the Vector series. And there's another indication which we use for the scalp PRP. And we check those results using a hair matrix imaging system.
Wow. Slightly stuck for my next question now. Amazing. Have you guys got any questions?
Can it be used on your hand?
Oh, yes.
Sure.
You get good
Of course.
results.
Yeah.
Especially for hands like mine.
What's wrong with your hands, Sandrine?
People say they're bony. I like
well.
them, but in actual fact, if you want to, but it's the thing that gives my age away. And
So-
what about these lines on your top lip? Can it help
Same
diffuse
thing.
those a little bit?
Yes, of course. You can use the same technique here, the nappage technique, or you can go a little bit deeper with a cannula, filling, giving a lot of product inside to repair, to correct the fine lines around the mouth. Yes,
Could
really
you use
nice.
something like this after a more aggressive technique like radiofrequency microneedling or laser
100%.
as a
Deliver.
real supercharging? Because when you've had that damage to the skin, this kind of stuff can get in there and say, oh, damage going on, we've got to repair, because wound healing is fundamentally what the stuff is doing.
Correct.
And so it can really amplify the
I'm just going over
results
the
you'll get from a procedure like that.
100%. So we have a number of patients in clinic at the moment, and they will have the intensive treatment that my young
Yeah.
patient had earlier for acne scarring. And Cheryl's currently under protocol with the patient where they'll have microneedling intensive on their stretch marks, for example. And these could be young patients, 33, 36, that just had their kids. The stretch marks are relatively fresh. And so that's a great time to catch the stretch marks when it's relatively fresh.
How long after childbirth? 6
90
months?
days? 90 days, Cheryl? Yeah,
Yeah,
we normally
90
treat
days.
as
Okay.
quick as we can.
Mhm.
So microneedling with radiofrequency, that way you've got the little microchannels,
Yeah.
and then the blood is spun before we've done the treatment. The needles are all
Yeah.
prepared, and then when the microchannels are done, there's already anesthetic in there, so they don't then feel
Okay.
this going in, which is perfect. And then we
Yeah.
finish off with Patrick's light therapy on
Yeah.
top of that.
To
So we're really vamping
supercharge
up the cellular
repair.
activation of the mitochondria.
Goodness.
Yeah. So
Okay.
there's all of that going on in the
Yeah, I mean
within
that's the
response.
real benefit of a clinic like yours, where you have all these technologies and also you've put them all together in a thoughtful way to enhance the results you're getting from everything, isn't it?
Yes. So
Because a lot of time when we're all thinking about maybe a treatment, we'll go and have it in isolation.
yeah.
And I get a lot of questions about people say, well, the doctor also said this and they also suggested that, and I feel I'm being upsold on whatever. You think, well, there depends, but usually there is a very good reason why they're suggesting these different things. There's more than one thing going on in your face at a time, particularly by the time we get to sort of midlife. So actually maybe having something before the procedure you're keen on will help prepare your skin for it. Having something afterwards will help enhance the results. So it could actually be a very good idea. But I guess for that you just have to educate the patients enough, and then they'll understand why you're suggesting all the things.
Absolutely, and there's been so many interesting points, and I'm going to bring up 2. The first one was your Profilo point. Where do we see all that fitting in? I love Profilo. I do a lot of Juvederm facial fillers for that real foundation, contour, refinement, and we get the job done really, really well. And then we finish off with a sprinkling of Juvederm Volite, gets the job done. But you're looking at about 50 little microchannels of hyaluronic acid on the skin.
Yeah, it's a bit of an ask, isn't it?
It's a bit of an ask for the patient,
Yeah.
because they have to grin and bear it. It's not bad, but now we have something a little bit more refined that we can do to really wake up the skin.
Sure.
But if I look at structurally, I can see my Juvéderm fillers going in to get a job done. I can see Profiler going nicely into the intradermal layer to give you that really beautiful finish instead of the volite. Sorry. And then finally a sprinkling of this, and I think that layered approach for someone who's older would be amazing. I now want to flip into a different point, which is now that we know the predictability of aging. There's a rough predictability. And when I think about our 20-somethings and our 30-something-year-old patients now, and they're seeing the ads and the fillers, and they're being seduced by all sorts of things online, I can see, maybe not now, but soon, in the next 5-10 years, I can see that population coming on board and starting younger, having prejuvenation treatments like this, which are more autologous in nature. And I know that when I become a parent, I'd be very comfortable with my child actually investing in their own cells this way with light therapy, and then leaving the fillers maybe for a later date, unless they had a structural deficiency.
Sure. And are you seeing younger patients are younger patients keener on autologous regenerative treatments rather than fillers? Because I've heard some surgeons saying to me that they get these youngsters in their 20s coming in and saying to them, I don't want to end up like my mum when I'm 40 having these fillers the whole time. Again, sorry, Tash, we'll love fillers, but
Wow.
and they're wanting PRP, they're wanting fat-derived sort of stuff, which I think, well, this is a very particular patient population because those treatments are very expensive. So if you've got a 25-year-old who's going to drop a lot of money on that kind of thing, I think that's unusual.
Yes.
But he was seeing a generational shift towards younger patients wanting treatments that they knew were something from their own bodies.
Yes.
Almost as a reaction to the previous generation. I didn't know if
That's so interesting.
happened in your
Not yet.
neck of the woods yet.
But everything's changing, and from pre-pandemic to post-pandemic, I can certainly see that there will be a paradigm shift. We always look at, the poor millennials, and they get it. They get it hard from us. It's like they want things fast, and they want things yesterday. They want big, and I feel bad for them sometimes. We shouldn't generalize. But what I do know about the new generation is they're very keen to look after themselves really well. They're certainly a lot more aesthetically knowledgeable than I was at their age. I didn't get glossy magazines, and we didn't even have a mobile phone till the age of 23. I didn't. So I had nothing to compare with. Whereas the girls nowadays, they might want a sharper jawline and all of that.
Sure.
However, I do know that they're much more clean living. They don't really drink and smoke like, how we maybe partied in the past. And I think they would be a little bit more open to investing in better quality ingredients and formulations and topicals and clothes and all sorts of things.
Yeah.
Can I just ask, how many vials of blood do you have to take for one treatment?
Just one.
one.
How many mils is it? 10 mils?
10 mils.
It's not much. It's like a small bit. Takes a minute, depending on how fast
It's less than 5 mils for the cellular matrix.
Yeah.
Yes.
You've got HA in the
It
tube.
seemed like you were putting quite a lot in.
They were just such tiny little beds.
Yeah.
So what was the total volume you had in the syringe? Was it
This is the cellular matrix thing. So you do take about 5 mils, and then you've got 2 mils of HA that goes in, and we've got about 7. Sometimes you get 6, sometimes you get 7 mils of plasma. So everybody's slightly different. Depends on how well hydrated you are, but Donna's very hydrated.
So will Donna be looking particularly plumped up and glowy for the rest of the day, having all this easing its way around through your face? Are you okay?
I feel okay.
Can I just ask, how long does that will that last? How many do you have, like a year? Yeah.
So you could do only one session?
seen-
You could do only one session, right?
Yeah.
Yeah, okay.
Face the light
So-
a bit.
Platelets contains a lot of growth factors inside, and when you inject platelets in the site
So
of
you see
injection,
platelets get
platelets will
dry.
release
So that's
the growth factor.
So
And
as
it
in
seems
shields,
that
stays
growth
too
factor
dry.
stays
Drops.
around 15 days, something like
Yeah.
this, maybe 3 weeks in the skin. So that's why we usually do 3 sessions, like a booster if you want, to start the process, the rejuvenating process if you want. And if you do it like this, if you do the right protocol, usually after it lasts something like 6 months, something like this, and at this time you do another session, just one, to improve your skin again and again. That's the idea. So when I do some areas like peri-orbital area and things like this, I can see the result. Even loss of volume correction. When I go deep and try to correct the loss of volume of the area, it lasts 6 months. So it's really interesting. And it's not a filler. It's only your own cells repairing everything deep and superficially. That's amazing.
I completely agree with Dr. Sandrine. I think what we're seeing a lot more now is even when you look at our existing facial fillers, we're seeing better longevity, better quality products. We're seeing all of that happening. However, when I compare my facial filler patients who only have fillers alone, and when I compare them when they have the other therapeutics, lymphatic drainage with the hydrofacials, a little bit of Soluma thrown in, and a touch of microneedling or all these therapeutics thrown in, they just supersede the standard filler patient in terms of their overall appearance.
Yeah.
They just look so much better. What do you think, Alice? Because you're the queen of the Tweakments. What are your thoughts?
Yeah, I mean, putting all these things together does end up with a greatly enhanced result, but it depends on somebody's budget and how many of those elements they want to put in. But yeah, personally, I just want to try as many things as I can to see. I'm always curious to see how they work alongside other treatments, whether I get a comparable result to the kind of testing that has been done in the trials on the product, all of that. But yeah, having a thoughtful approach and adding in things like the nutraceuticals, absolutely, I'm hooked on all those. I won't stop doing those. The light treatments at the other end of it, absolutely, added to great skincare, all of those things, and then strategic treatments in the middle that work sensibly. Yeah, totally.
Do you mind me asking if you've had something like this?
Not exactly like that. I've had PRP once or twice, just as a one-off thing with the cannula through the mid-face, kind of fanning it through, and it's nice, and I see a bit of a glow, but I only had one session. But then the other reason I find it quite hard to judge is that my skin's in reasonably good condition anyway, and I've looked after it over the years. So I'm a harder patient to show a difference on than most. So a lot of the things when I'm filming for my website, people will want not me on the bed as a treatment patient, but somebody who has more pigmentation or who needs more filler in their face or whatever, because on that kind of patient you can show very much what can be done more clearly.
A more dramatic change.
A more dramatic change, exactly. But when I then see quite how much pigmentation one session of laser and combined intense pulse light can clear, then actually I stick my hand up and say, actually, sorry, Doc, can I come back about as well? Because I know I won't show the same kind of dramatic change before and after on the Visio pictures, which I really recommend as a baseline for anybody doing that kind of thing. But I know it will give as much of a result as it can, because I see what it can do for a perfectly normal person who hasn't had any of these treatments.
Thank you.
Thank you.
Yeah, well, thank you very much.
Thank you.
Big round of applause for Donna, everyone.
Thank you, Mark.
Thank you, Alice. That was amazing.
Yes.
Yeah, and then you post it to the grid to say that.